For over a century, medicine believed the human stomach was a sterile, acidic furnace where no living bacteria could survive. But in June 1984, a single paper published in the Lancet shattered that dogma forever. Welcome to the Science Storyteller. I am Pharmacist Mohamed Kamal, and here I tell science like a story. For decades, doctors blamed stomach ulcers on stress, spicy foods, and excess stomach acid. Patients were forced into lifelong antacid treatments or painful, life-altering gastric surgeries. But at Royal Perth Hospital in Western Australia, two researchers began noticing something everyone else missed. Pathologist Robin Warren noticed unusual curved bacteria on gastric tissue samples, lining the inflamed mucosal layer. Standard stains missed them, but under silver stain, tiny spiral organisms appeared like dark shadows. Senior colleagues dismissed them as simple contamination or accidental bacteria introduced after biopsy. Enter Dr. Barry Marshall, a young gastroenterology fellow who joined Warren to test this controversial idea. Together, they designed a rigorous trial, enrolling 100 consecutive patients undergoing routine gastroscopy. From each patient, 2 tissue biopsies were taken, strictly from intact mucosa in the gastric antrum. To limit bias, samples were evaluated independently and usually blind. Though the researchers themselves admitted the process wasn't perfect. But culturing the organism proved infuriating. For 34 consecutive patients, every single agar plate showed 0 growth. Standard protocol dictated throwing culture plates away after 48 hours, assuming anything pathogenic would have grown. Then came Easter Thursday, 1982. An unexpected hospital holiday rush left patient 35's plates in the incubator untouched. 6 days later, staff returned to find tiny, translucent colonies blossoming across the moist chocolate agar. Electron microscopy revealed an extraordinary beast. Curved rods armed with 4 sheathed flagella sprouting from a single pole. Looked like Campylobacter, but its unique flagella set it apart. Marshall and Warren called it, cautiously, pyloric Campylobacter. When the blinded code was finally broken, the statistical correlation shocked the entire research team. Out of 13 patients with duodenal ulcers, every single one, 100%, harbored the spiral bacteria. For gastric ulcer patients, 77% carried the infection, and in active chronic gastritis, 95%. How did these bacteria survive lethal gastric acid? They didn't float in acid, they burrowed beneath the mucus layer. Here, in a near-neutral pH microenvironment shielded by the antrum's naturally alkaline mucus, the bacteria found a safe harbor the acid could never reach. This explained why past researchers failed. They cultured gastric fluid, where stomach acid destroyed every bacterium in minutes. The paper also solved a medical mystery: why patients treated with acid blockers experienced endless ulcer relapses. But when patients were given bismuth salts, a known antibacterial compound, the bacteria vanished and the gastritis healed. Yet, despite publishing in the Lancet in 1984, the global medical establishment refused to accept their findings. To fulfill Koch's postulates and prove his point, Dr. Barry Marshall took a desperate, extraordinary step in July 1984. He drank a murky beaker full of cultured spiral bacteria, purposefully infecting his own healthy stomach. Within days, he developed severe gastritis, vomiting, and biopsy proof of massive bacterial infection, proving cause and effect. Marshall then cured his own raging infection with a simple course of antibiotics and bismuth. proving ulcers were curable. Later renamed Helicobacter pylori in 1989, this single discovery transformed stomach ulcers from a chronic lifetime burden into a simple curable infection. In 2005, 21 years after their paper was dismissed, Barry Marshall and Robin Warren were awarded the Nobel Prize in Medicine. Their journey reminds us that in science, dogma is the enemy of truth, and curiosity can change millions of lives. If you love discovering the untold stories behind modern medicine, subscribe to the Science Storyteller and journey with me again next time.